with social distancing guidance and mask wearing requirements. We therefore appeal to persons who are not required for work during this curfew period to remain at your residence. Businesses and establishments are encouraged to close their operations in sufficient time to permit their staff and patrons to get home before the curfew begins. Restrictions on social events. The new regulations still prohibits mass gatherings and provide for limited social activities with the approval of the Commissioner of Police. When granting permission for these activities, several risk factors are considered. 1, the number of COVID-19 cases in the community. High or increasing levels of COVID-19 cases in the event location or locations the attendees are coming from will increase the risk of infection and spread among attendees. There are currently about 50 active cases of COVID-19 in the Federation, and we have an average of about 5 new cases daily. These numbers are taken into account when applications are being processed. The setting of the event. Indoor events, especially in places with poor ventilation, poses greater risk than outdoor events. The length of the event. Events that last longer poses more risk than shorter events. Being within 6 feet of someone who has COVID-19 for a total of 15 minutes or more significantly increases risk of becoming infected. The number and crowding of people at the event. Events with more people increase the likelihood of being exposed. Therefore, events with higher numbers may be given less favorable consideration. The behavior of attendees during an event. Events where people engage in behaviors such as interacting with others from outside their household, singing, shouting, or not maintaining physical distance, or not wearing masks consistently and correctly increase the risk of infection. Once we would have weighed these risk factors, we then make a determination on the level of risk we are prepared to take, and a decision is made accordingly. Quarantine. Quarantine is used to separate and restrict the movement of persons who may have been exposed to a communicable disease, such as COVID-19, or who may have traveled from a country that is considered a hotspot for the virus, to see if they will eventually become ill. The current emergency powers regulations require all incoming travelers to undergo a period of quarantine before they integrate into the community. Regulation 14.5 provides that all arriving travelers who are fully vaccinated against the COVID-19 virus shall A, remain in a government-approved COVID-19 hotel or quarantine facility for a period of 4 days, or B, quarantine at a private residence certified by the National COVID-19 Task Force for a period of 4 days, and no private security is required. Subsection 6 provides that all persons who are not fully vaccinated shall remain in quarantine for at least 14 days at a government quarantine facility. Children under 18 years who are traveling with fully vaccinated parents will be subject to the same quarantine time as their parents. Persons in quarantine shall only be released from quarantine upon receiving a negative RT-PCR test. Incoming travelers who wish to quarantine at home must first apply online at www.covid19.gov.kn and complete the pre-approved home quarantine application form and submit same. Representatives of the task force will visit the property and inspect it, and then you will be notified whether or not your application was successful. Persons whose applications are approved will be sent formal notification along with the guidelines and conditions of their quarantine. It is important to note that any violation of the quarantine conditions will lead to criminal prosecution under the Quarantine Act, which provides for fines of up to $5,500 or 6 months in prison upon conviction. We look forward for your fullest cooperation with all of these prevention measures, which are intended to keep us all safe. Thank you.
Thank you, Superintendent. I now invite Dr. Hazel Laws, Chief Medical Officer, to present us with the Health Emergency Operations Committee Situation Report.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. This afternoon, I will share with you the Health Emergency Operating Committee's situation report. On May 19, 2021, we identified the first COVID-19 case in this second wave of COVID-19 infections. Over this past 3 months, we added 585 COVID-19 cases to our tally. Over these 12 weeks, we have noted 533 recoveries, and at present, we are monitoring 49 active cases. There are 2 COVID-19 cases admitted at the COVID-19 ward, JNF General Hospital. This slide shows the epidemiological curve, and as you can see, we are at the tail end. The number of COVID-19 cases is on the decline. In fact, our daily case counts are in single digits. At present, we reported a total of 630 COVID-19 cases, with 22 cases identified in Nevis and a total of 608 cases identified in St. Kitts. As I said before, we've had a total, that is between last year and present, a total of 578 recoveries. We are monitoring 49 active cases, and so far only 3 COVID-19 related deaths. This afternoon, I want to report that we have successfully contained the COVID-19 outbreak in the prison system. And so earlier during this wave, we identified a total of 56 inmates who were diagnosed with COVID. They have all recovered, and a total of 18 staff members or prison officers were diagnosed with COVID, and they have all recovered. And I want to update the public that at present, no visiting is allowed at the prison. Now, in terms of our vaccine program, at end of work day yesterday, we administered a total of 43,966 vaccine doses. And in terms of the coverage rate, so far we've achieved a coverage rate of 72.5% of the target population covered with the first dose of the vaccine, and 60.5% of the target population fully vaccinated. More specifically, a total of 20,000 persons in the Federation would have received 2 doses, or they are fully vaccinated. In terms of the vaccine program, let me just break it down a little further. the target population refers to the adults in the population, those 18 years and over. And based on the last census, approximately 33,037 persons comprise the adults in the population. And so in terms of the first dose coverage, 23,966 would have received a first dose, and 20,000 persons would have already received 2 doses, or they are fully vaccinated. So at present, we have approximately 9,000, a minimum of 9,000 adults remaining to come on board in terms of accepting the COVID-19 vaccine. Again, this data is based on the last census conducted in 2011. Now, at present, we have a batch of AstraZeneca Oxford vaccine. Now, this current batch expires at the end of August, the end of this month, August 31st. Now, persons who received their first dose of vaccine between June the 3rd to June the 30th, we recommend that you return now or within the month of August for your second dose. Now, during the month of June, once you got your first dose, towards the end of the first week to the end of June, you were given a 12-week appointment because we weren't sure when we would receive the current batch that we have in hand. And so please note that the recommended interval between the 2 doses is anywhere between 4 weeks or 1 month to 12 weeks. Now, please note also that the World Health Organization recommends that you can receive that second dose anywhere between 8 to 12 weeks after the first dose, and you would achieve an acceptable efficacy level. And so those who would have received their first dose around about June 9th, 9 weeks have already elapsed between your receiving the first dose and the present. So in other words, you can come and you can return for your second dose anytime now. Those persons who received their first dose during the second week of June, 8 weeks have already elapsed, and so it is safe for you to return now for your second dose. So I repeat, persons who would have received their first AstraZeneca Oxford dose in the month of June, we recommend that you return anytime now to receive your second dose. Again, this current batch of vaccine expires on August 31st. I want to just comment a little bit about COVID-19 vaccine and pregnancy. Pregnant women are at an increased risk of getting severely ill from COVID-19 and can indeed experience adverse pregnancy outcomes. And so the vaccine, the COVID-19 vaccine, can prevent COVID-19 in pregnancy, and it can help to prevent some of these potential adverse outcomes. And so it's now a recommendation for pregnant women to get vaccinated against COVID-19. So here in the Federation of St. Kitts and Nevis, the COVID-19 vaccine will be administered to a pregnant woman who, upon submission of a letter from the obstetrician and gynecologist granting clearance. So in other words, if you are pregnant and if you visited your obstetrician and gynecologist and if you discussed the whole issue of accepting the COVID-19 vaccine, if you consent and you ask or request a letter from your obstetrician and gynecologist, once you submit this letter to the nurse at any of the health centers, we will administer the vaccine. Our contact tracing, we continue the robust contact tracing process, and up until yesterday, August 10th, a total of 2,799 individuals would have been interviewed, and 2,703 persons were released or have been released from self-quarantine, and we are presently monitoring almost 100 persons who remain in self-quarantine. So yes, we continue the contact tracing process. We continue testing individuals who present with signs and symptoms of COVID-19. Over this past 3 months, we conducted well over 17,492 samples. So in other words, we took well over 17,492 samples, which were processed at our local labs. Okay, so Superintendent Henry touched on the change or the amendments to the health and travel protocols, whereby inbound vaccinated passengers are allowed to return to the Federation once they would have submitted a negative RT-PCR test prior or done within 72 hours of travel. They can now qualify for a reduced quarantine period of 4 days. Please note that the exit sample will be taken on the morning of day 4. Again, you have to apply online to have your private residence certified for your quarantine, if that's your wish. Please note the URL, it's covid19.gov.kn. Okay, and so just to underscore that if you qualify for the reduced or the reduction in quarantine, 4-day quarantine, if you are traveling with a child and the child is unvaccinated, the child will be subject to the same quarantine time as yourself. Now, I just wanted to add this bit of information. So inbound passengers who are fully vaxxed, and if your premises is certified for quarantine and you've been granted approval to serve your quarantine at home in a private facility, you must sign a notice of quarantine form upon arrival at Robert Llewellyn Bradshaw International Airport. And this is just a picture of that form. Please also note that your COVID-19 test sample will be taken on the morning of day 4 of your quarantine. Now, there are 3 identified sites in St. Kitts where you can access or get your sample taken. And it's at either of the 3 hospitals. That's the JNF General Hospital, the Parkson Hospital, and the Mary Childs Hospital. The time, 7 a.m. Each morning. So your sample will be taken between 7 and 8 a.m. each morning. No swabs will be taken after 8 a.m. In Nevis, your test sample will be taken at either of 2 locations. The first is the Disaster Management Building, and the second site, the Gingerland Health Center. You are required to use only private transportation to drive to and from the hospital or testing site to have your exit sample taken, and you must wear a face mask and sanitize on this trip. You shall only be released from quarantine after receiving a negative RT-PCR test. I want to spend some time talking a little bit about the Delta variant, which was first identified in India. It is referred to as one of the variants of concern. Please note that it is the most contagious version of the coronavirus or the SARS-CoV-2 virus to date. It is spreading worldwide, and it's now responsible for over 82% of infections diagnosed in the United States of America. I want to share 5 things about this Delta variant. 1, the Delta variant is more contagious than the other virus strains. It is spreading. They've conducted studies, and they have found that the Delta variant was spreading 50 times faster than the Alpha variant, which is the variant that was first identified in the United Kingdom towards the end of 2020, and it has been found to be spreading 50 times more than the original strain of the COVID-19 virus. Please note that unvaccinated persons are at risk. So persons who are not fully vaccinated against COVID-19 are at the most risk. Now, the Delta variant can lead to hyperlocal outbreaks. What does this really mean? What they are finding is that in those territories, like in the United Kingdom, the United States, the Delta variant is skipping and jumping from poorly vaccinated areas to other poorly vaccinated areas. Now, there is still more to learn about the Delta variant. And the fifth point, vaccination remains the best protection against this variant. The AstraZeneca Oxford vaccine was 60% effective against symptomatic disease caused by this variant and 93% effective against hospitalization. The Pfizer Biontech vaccine was 88% effective against symptomatic disease caused by this variant and 96% effective against hospitalization as a result of this variant. It's just a matter of time before the variant gets here. That is if it's not already here. Well, let me just pause to share or just to underscore that the last or the latest batch of about 4 or 5 samples were dispatched to the Caribbean Public Health Agency for genomic sequencing round about the 28th of July. So we are not sure as yet, but it's just a matter of time before we identify the Delta variant here. So how can you and I prepare ourselves for this eventuality? Well, we need to adhere to the COVID-19 protective measures, wearing the face mask at all times, maintaining the safe distance of 2 meters between yourselves and others when in public spaces, ensuring that you maintain good hand hygiene and vaccination. If you have not already accepted the vaccine, please consider same. The Delta variant is more than likely going to be the cause of the next surge in the Federation, but we can prepare ourselves and we can mitigate against the consequences. So in the Ministry of Health, we are preparing by strengthening our contact tracing procedures. We are preparing by augmenting our testing capacity. We are preparing by training our staff in terms of the clinical management of COVID-19. We are also preparing by augmenting or improving the COVID-19 vaccines that are being offered to the population. The U.S. government's donation of the Pfizer Biontech vaccines to the Caribbean nations was announced today. I saw it in the media. And in St. Kitts and Nevis, we are expecting the first of 3 shipments tomorrow. Now, the shipment we expect will contain approximately 11,700 doses. And the Ministry of Health, we have made all the preparations in terms of receiving these vaccines, appropriate or adequate storage, distribution, and administration of these vaccines. Please note that as far back as March the 22nd, if I'm not mistaken, there was, we had universal eligibility in vogue, whereby adults could accept the AstraZeneca Oxford vaccine. Now, in terms of the Pfizer BioNTech vaccines, anybody or all persons 12 years and above can present and accept the Pfizer BioNTech vaccine once we announce the date when we would begin or commence administration. Thank you.
Thank you very much, Dr. Laws, for the health presentation. Before I introduce Mr. Abdias Samuel, who is the chair of the National COVID-19 Task Force and National Disaster Coordinator at NEMA, I want to recognize the Honorable Wendy Phipps, who is the co-chair of the Disaster Mitigation Council, and the Honorable Akila Byron Nisbet, who is the Minister of Health, who have joined us at today's briefing. Mr. Samuel.
A pleasant good afternoon to all, and thank you, Mr. Williams, for your introduction, and welcome everyone to another NEAC COVID-19 briefing. I just want to address a few matters today. One being the application for quarantine waiver. And again, we have been saying that this criteria applies to students who are studying abroad and are living in St. Kitts and Nevis, persons who would have traveled overseas for critical care, that's health care, and also for the elderly over the age of 62 years of age who are living in St. Kitts and Nevis and would have gone overseas for some sort of critical care as well. This particular service that is being provided by the government of St. Kitts and Nevis has criteria to it, and it's done on a case-by-case basis. So it's not an automatic service that you just receive because I am a student. We have been seeing a lot of cases of persons who have been living overseas for many years, and they decided to study overseas, and they now want to come home for vacation or for a funeral, and they are requesting for the waiver to be granted. Again, the waiver is for students who live in St. Kitts and Nevis, nationals who would have gone overseas to study and are now returning home for vacation or whatever other reasons, or have finished the studies and are returning home. I just want to make that clear because of the number of applications we are seeing and the rationale being given for the application. And we have stated over and over that you have to show proof of some form of ID. You also have to submit with that your proof that you are a student, maybe your some form of letters, acceptance letters from the school or ID from the school. That in itself will suffice for the application. Again, it's done on a case-by-case basis, and you will receive a response whether you have been approved or not. Again, you would have listened to Superintendent Henry speak to the amendments to Section 14 of the COVID-19 regulations, along with CMO Dr. Hazel Laws, who would have spoken to the procedure. Again, let me just walk you through the procedure. So you are fully vaccinated with the vaccines that are acceptable. Please visit the covid19.gov.kn website, or please review our health and travel protocols for St. Kitts and Nevis, and you will see the vaccines that are accepted here, including the mixed vaccines. Meaning that if you take a shot of AstraZeneca and a shot of another one that is approved, my understanding now is that that is also acceptable. You show your proof of that in your application of your being fully vaccinated, that 14 days has elapsed. Your application will then be reviewed. Someone will be assigned to inspect your property. Once that inspection is done using the criteria that is on the website, then you will receive, once it's approved, you will receive a letter. That letter will be explaining to you the approval and also the terms and conditions, along with a confirmation number. And that confirmation number must be uploaded to the entry form to enter the Federation of St. Kitts and Nevis. That is what is going to be used to cross-reference the review of your application to ensure that you do qualify for home quarantine, and that process has been fully approved. Upon receiving that, and you enter the Federation, you will, for now, you will still be using a COVID-19 certified taxi to take you to your place of quarantine or vacationing place. So we want to make sure that citizens understand the procedure. I must report that since this announcement was made public, we have received, actually the applications have gone up by almost 100%, meaning that once ago we had small numbers when it was security, when you had to apply security to it, but now you have more applications. Please give yourself sufficient time to receive an adequate response so that you can plan appropriately. We have receiving requests today for tomorrow. That is not applicable, and the team would not be able to process you today for tomorrow. I am advising individuals to give yourself at least a 7-day period for you to get an adequate response, as the process is new and everybody is getting familiarized with the process. So give yourself a minimum of 7 days of applying ahead of time, your traveling time, so that you know if you will know if you qualify to receive home quarantine. I also want to inform the public that St. Kitts and Nevis would have experienced some of the effects of the passage of Tropical Cyclone 6, which would have passed some 100+ miles south of St. Kitts and Nevis. St. Kitts and Nevis would have experienced moderate to heavy rainfall at times, and some areas would have also experienced some thunderstorms. In this regard, I must report, and I am pleased to say, that there was no significant damage sustained as a result of the passage of this weather system. However, this is a great opportunity for you to continue to prepare, as we are now in the peak of the hurricane season, and that means you will see more activity in the Atlantic hurricane basin. So use this opportunity now in what we call the peacetime, where we are not being threatened or under the risk of any type of tropical activity, to prepare, review your hurricane plan if you have one. If you don't have one, please prepare one and be prepared. So let us be proactive and let us not be reactive when these situations arises. Again, we continue to prepare for the CPL that should be occurring within the next few weeks. We have seen the arrival of a number of players in the Federation, and we will have other numbers arriving in the Federation soon. So we are asking the general public to be mindful of such. Again, we want to continue to encourage you to adhere to the protocols, and we are excited now that we are getting the Fisa vaccines. Many citizens and residents have been engaging regarding their sons, daughters, and now you have the opportunity to get them vaccinated here in St. Kitts and Nevis, and you don't have to fly overseas to get them vaccinated. So now that we are getting the vaccine, use the opportunity to vaccinate your children, protect them against this virus, in particular the Delta variant, and also for those persons who spoke to me about options. I want to thank the Honorable Akila Byron Nisbet and the team, and also by extension the government, who has been in dialogue with the government of the United States of America in making these vaccines accessible to us. So with that said, we are hopeful that you can support the efforts and the programs of getting our population vaccinated so that we can continue the rollout of the vaccine. And another important message I have for our friends, colleagues, citizens, and residents in the United Kingdom is that as of the 1st of September, the travel advisory against the United Kingdom will be lifted. Again, the travel advisory against the United Kingdom will be lifted as of the 1st of September. So we will be engaging with the British Airways management group for the Caribbean region so that these flights can resume as soon as possible. So thank you again, Mr. Williams, and we will now welcome your questions.
Thank you, Mr. Samuel. The first question is for Dr. Wilkinson. Dr. Wilkinson, we have one of the highest vaccination rates among adults in the region, if not the world. Just last week, the US celebrated reaching 70% of adults vaccinated. We got to the 70% mark a couple weeks ago. To what do you attribute this success?
That's why just this morning I was at a regional meeting with the Prime Minister, and the same question was asked of him about the success of our vaccination program and the coverage that we have and the high percentage of persons who showed up to be vaccinated. And I can encapsulate the answer in one word: confidence. In that I believe that the people of the Federation showed confidence in our education program at every single level. They had confidence in the message that we delivered about the safety and the efficacy of the vaccines, and that's why they showed up in large numbers. And I want to thank everyone who was involved in the education program. They also showed confidence in the health services that were delivering the vaccines, which means everyone who worked in all of the health centers throughout St. Kitts and Nevis. And I want to thank all of the nurses and the allied staff who were involved in the vaccines and delivering the vaccines to persons who showed up on a daily basis to be vaccinated. And lastly, they showed confidence in the policymakers who were responsible for the overall program. And we have to thank first the Prime Minister of the Federation of St. Kitts and Nevis, the Minister of Health, who is here with us, the senior persons in the Ministry of Health, the Permanent Secretary, the CMO, and every member of the HAOC and the NAOC, Mr. Abdiel Samuel, and everyone who was involved in the vaccination program. So I believe that that is the reason for the success, and we also have to thank again the people of the Federation of St. Kitts and Nevis who were receptive to all of that. With that said, we haven't stopped. We'll continue to push forward, and I'm happy to hear that we have the Fisa Biontech that arrived in the Federation, and I ask everyone to continue to show up at the health centers to be vaccinated, specifically those parents who were concerned about the children, the 12 to 18-year-olds. And so I'm looking forward in the next couple of weeks to see a significant number of persons again showing up to be vaccinated.
Thank you, Dr. Wilkinson. These two questions are from WIN FM. Has anyone reported any long-standing symptoms after recovering from COVID-19? I think it's what you call long COVID. And the second question, is the Delta variant in St. Kitts and Nevis?
Well, let me start by saying that long is relative, because this pandemic reached St. Kitts about 18 months ago, and we continue to see persons showing up with symptoms. And yes, there are persons who are continuing to have long-haul symptoms even after they have tested negative and deemed fully recovered. And that is why it's so important to protect yourself through vaccination, so that you can avoid the chronic fatigue symptoms, the forgetfulness, the muscle aches, etc., and just generally not feeling your normal self. And so I encourage everyone to go forward and get vaccinated. The question as to whether or not the Delta virus is here, you said, the CMO indicated that we sent off further samples for genomic sequencing. However, the same way when you have an expiration date on a drug, the drug just doesn't go bad the very day or the minute after the expiration date. The Delta virus doesn't arrive the day the CMO announced that we got that confirmation from CAFA that it is here. And so we need to prepare ourselves. If the Delta variant is rampant in the United States, and if we have 5 flights a week coming from the United States, if the Delta variant is in the United Kingdom, and despite the fact that we had a travel advisory on the UK, persons were still coming in through Antigua, the Delta variant might well be here. But the way we protect ourselves against the Delta variant is by getting vaccinated.
Another question from Win FM. A viral video showed congregants flouting the COVID-19 protocols. What is the COVID-19 task force doing to prevent further breaches? Superintendent.
I am not aware of this video. I'm not certain which video the person asking the question is speaking about. But whenever any breaches of the protocols are brought to our attention, the appropriate action is usually taken.
Dr. Wilkinson, this question is for you again. How fearful should we be of the Delta variant getting here, and what measures we have in place to keep it out? That is one. I think you partly answered it in your last response. Dr. Wilkinson, the vaccination rate appears to be grinding to a halt. There is still 28% of adults unvaccinated, and every day the numbers showing up for vaccines appear less and less. Is this a failure of the vaccination program?
Well, first let me say, every day someone shows up to be vaccinated is a successful day, because that is one more person who is saved from severe disease, hospitalization, and has significant protection as it relates to dying from COVID-19. And so whether I see figures of 660 or 6, it's a happy day, and it speaks to the success of our vaccination program. With that said, however, there is complacency. There is complacency in Sinkers. There is complacency as it relates to vaccines throughout the entire world. And we continue to work on this complacency so that we can have a shrinking of the number of persons who are unvaccinated. And I've said several times before here that being unvaccinated is not a race or gender that cannot be changed. In May, about 3 months ago, we only had about 10 or 15% of persons who were fully vaccinated. Today, we have over 60% of persons who are fully vaccinated, and that shows that the status of being unvaccinated can change, and we continue to work to make sure that we get this change. I can tell you that as a doctor, every day when I sit in my office, I speak to every single person about being vaccinated. And the majority of persons who are not vaccinated, some of them are just simply undecided. A lot of them are simply being misled. And I want to speak to persons who know better and who have a platform. If you know better and you have a platform to spread information out there, you need to desist from spreading misinformation, and join the education program in letting people know that the vaccines are safe and effective, and this is the only way we can save lives, save our country, and get the economy back on track. And so I don't believe that there is any failure in the vaccination program, even if we only have one person showing up per day.
Thank you, Dr. Wilkinson. These next two questions. Can you explain the rationale for having travel advisories in relation to Brazil and South Africa, but no such advisory in relation to travelers from the United States? And the second one, what is the inspection of private households for, since there will be no security guard?
I just want to first refer to part of a question that you asked before about how fearful we should be of the Delta variant, and just refer to some notes that the CMO just gave in her presentation. Yes, we should be fearful of the Delta variant because, one, it is more transmissible. We know that with the original virus, without any protection, one person can infect 2.5 persons. With the Delta variant under the same conditions, one person can infect 9 persons. We hear that is even more infectious than measles. The recent data is also showing that it's associated with more severe disease, especially in the elderly and those with pre-existing conditions. It also can more adversely affect children. We know in the early days we said with the original virus children were doing well, but data coming out of countries where the Delta variant is rampant shows that the hospitalization rate for children is increasing with the Delta variant. We also know that even if you are immunized, that you can become infected and spread the Delta variant. And so we need to prepare for the inevitability of the Delta variant reaching here with the same sense of urgency that Mr. Samuel spoke about when we are preparing for a hurricane. Because if he were to come here tomorrow and said that there was a hurricane going to be bearing down on us, every single citizen will be closing up their house, making sure they put on their shutters, boarding up, etc. And so the way we prepare for that is by getting vaccinated. Now, as it relates to the question that you just asked about the Delta variant in Brazil, etc., South America, and the travel advisory, it's all a matter of proportionality. We initially had a travel advisory on every country that had the Delta variant. As our vaccination rate increased and we have greater protection, we lower the bar bit so that we can absorb some more risk knowing that we are protected. And so the Delta variant is in the United States. We have 5 flights coming here, but we have been doing well with our high vaccination rate. We have decided that we will remove the advisory from the UK, and in time you will see other advisories be lifted, but the situation is very mercurial, and so if the situation changes where our healthcare system appear to be getting overwhelmed, we might even put back on travel advisories. And so we follow the science, we follow the day-to-day activity, and we make decisions based on risk and benefits.
Okay. That's why a question was asked regarding why inspect the property. Every property will not have the conducive environment to facilitate a clear separation from that inbound passenger who is still considered somewhat risky. I won't say high risk, but risky. with persons who may be in that same household who may not be able to have that clear separation, and they might compromise them. So the inspection will basically ensure that the individual will be able to have the conducive environment to carry out the protocols that is required for quarantining for those 4 days. Otherwise, these individuals will be informed that their property is not conducive, and they will have to look at an alternative option.
Somebody is asking a very simple question, but nonetheless, they want to know if their vaccination card, got lost. What should they do?
First of all, let me say that you should put your vaccination card in a very safe place, the same way you keep your passport in a safe place, your driver's license, etc. There have been persons who've been showing up claiming that their vaccination card has been lost, and in time it can be replaced. However, as more and more persons are doing this, and this, you can genuinely lose something, but sometimes you can lose something because of irresponsibility. And there might be a fee associated with it in time to come if this continues. And so I just want to encourage persons, when you get your vaccination card, to put it in a safe place, because it's going to be required sometimes for traveling now. And so you need to make sure that you have it in a place where you can pull it if you need it.
Lesroy, in one of the previous questions, whereby the question posed referred to the South African variant and the Brazilian variant. Now, apart from the Delta variant, which was first identified in India, which is now very prevalent in the United Kingdom and the United States of America, in South Africa, you have the Beta variant, and in Brazil, you have the Gamma variant. And so that's why the travel advisories remain regarding travelers, inbound travelers from South Africa and Brazil. I don't think we can open to all at once. It's a phased approach. Thank you.
Good evening, and Leslie, just to add to the vaccination card, just to let the general public know that the Ministry of Health is now looking into being able to provide the vaccination cards electronically as well. So soon enough, we'll be able to provide you with an electronic version of your vaccination card. We're just working through the finer details of it, but that should be done shortly.
Okay, these next two questions are for Dr. Wilkins. I will ask them in one shot. What is the herd immunity threshold, and is it really achievable with the now highly transmissible Delta virus? And the second one is related to the Pfizer vaccines that we will receive from the US. Do we have the -80-degree and -20-degree freezers necessary for the effective storage and distribution of the Pfizer vaccine? Minister of Health.
I'm actually happy to report that the Ministry of Health is in possession of both a -80 and a -20 refrigerators required for the storage of the Pfizer vaccines. And at this time, I want to send our gratitude to the St. Kitts Biomedical Research Foundation, who would have donated the -80 freezer along with all of the Pfizer vaccine racks required to store the vaccines within the freezer. So we want to show our gratitude to the St. Kitts Biomedical Research Foundation for that donation. But yes, the Ministry of Health at our JNF hospital, we do have in our possession both the -80 and the -20 refrigerators necessary for us to be able to store the Pfizer vaccines.
As it relates to what is the threshold for herd immunity and if it is achievable. Well, just briefly, the whole concept of herd immunity is that if we had a significant proportion of the population vaccinated and immunized, even if 1 or 2 persons got infected, there would be no significant transmission because those who were immunized or those who were previously infected would not transmit the virus. However, COVID-19 is teaching us something different because almost a year and a half into the pandemic, we now know that even persons who were infected before, they can be infected again. We know that persons who are immunized, they can be infected and transmit the virus. And so the whole concept of reaching herd immunity, it's changing, and I'm sure that you have been hearing me speaking recently of having a significant proportion of the population vaccinated because the original threshold was set at 70%, but with the development of new variants that are more transmissible, that threshold increases. And every time a new variant comes out that is more transmissible, the number will be moved further upwards. And so there are a number of reasons to why reaching herd immunity in a number of populations might not be possible. Because 1, with the development of the variants, as I said, 2, vaccine hesitancy, where it might be impossible for you to get to the population coverage that you want because of vaccine hesitancy, and the fact that children themselves cannot be covered. And so most persons are looking to see if they can get as many persons who can be vaccinated, and that threshold can be up to 90%. I'm happy that we have had 70% of our adults with 1 shot, and hopefully we would be able to reach 70% who are fully vaccinated. We'll be starting vaccinating children between the age of 12 to 18 pretty soon. And so with a significant proportion of the population vaccinated, without speaking about herd immunity, we should be safe. Because I've said before too, herd immunity is not an on and off switch where you reach there and you put down your victory flag and you celebrate and say things are over. The virus is going to be with us for quite a long time, and we need to continue to use non-pharmaceuticals and continue to get everyone who should be vaccinated. And I've said before, if you can be vaccinated and you're not, you have a moral responsibility to do that, because now that we know too that the Delta variant can adversely affect younger children, it can adversely affect older adults with pre-existing conditions. You have a responsibility to try and protect those persons, including protecting yourself through vaccination. So I ask you to go to the health centers and get vaccinated.
Thank you, Dr. Wilkinson. We soon will be wrapping up with our question and answer, but these 2 questions. Would the Ministry of Health support the recommendation that as far as possible that persons reluctant to take the vaccine get clearance or advice from their healthcare provider? And the second one is, under what circumstances can someone still die after having been fully vaccinated?
Well, we have been saying all along that if you think that you have a health condition that might negatively affect you coming forward to get the vaccine, you can get clearance from your doctor. And so this is no new policy with the Ministry of Health. I want to ask the doctors out there, though, that they need to exercise sound judgment when they're telling persons yea or nay, because we've been seeing some certificates that are coming in. For example, persons being told that they can't get the vaccine because their cholesterol is high or because they have an allergy to penicillin. And so those are not sound reasons. And so the same way you can get a second opinion for a health condition, if you went to a doctor and you weren't sure about the certificate that was given to you, you can get a second opinion. The other part about under what conditions one can die if they are fully vaccinated. Well, people die from asthma around the world every single day. And so if you have something that can trigger a significant asthma attack, you can go into status asthmaticus and die, whether or not you are vaccinated or not. And so it is not necessarily the virus itself that might kill you, but the complications associated with the virus. And so getting vaccinated would not stop you from going into status asthmaticus if you got COVID-19, developed a respiratory problem, and then went into respiratory failure. Getting vaccinated will not stop you from dying if you got COVID-19 and you had a bad heart and you deteriorated. But getting vaccinated can prevent you from becoming severely ill from COVID-19 and developing the complications of these diseases. And that is why we say if you have some of these pre-existing conditions, it's important for you to come forward and get vaccinated so that you would not have COVID-19 being complicated with your other pre-existing conditions that can push you over the edge.
Thank you again, Dr. Wilkins. So these are our last two questions for today. The first one is, what if the AstraZeneca vaccine finishes before one gets his second shot, that is before the end of August? Can that person take the Pfizer vaccine for his or her second shot? And the last question for the day is, are there freezers in Nevis as well to house the Pfizer vaccine?
All right, so Mr. Williams, we thank you for those two questions. And so there will be individuals who would receive their first dose of the AstraZeneca close to the end of this month, and we will endeavor, we will try our very best to secure additional doses of the AstraZeneca Oxford vaccine to be able to provide them the second dose within the 12-week window. Yes, however, there is a possibility that individuals can have AstraZeneca Oxford vaccine as the first dose and the Pfizer Biontech as the second. There are some countries, including Canada, that have adopted this mixed regimen, vaccine, COVID-19 vaccine regimen. So that's a possibility. But our first choice would be, as the Ministry of Health and the government of the Federation, to try and procure additional doses of the AstraZeneca vaccine to complete the dosing regimen for those who would have received the first dose before the end of this month. Now, in terms of the ultra-cold storage for the Pfizer BioNTech vaccines, so we do have a negative 80 degrees refrigerator at the central medical stores and negative 20. But in terms of the protocol that we will be using, the vaccines can be adequately distributed from the central medical stores to the distribution point in Nevis to the regular refrigerator well within the recommendations of the manufacturers. So you actually really do not need a negative 20 degrees refrigerator in Nevis. So the short answer is the vaccines can be adequately distributed from the central medical stores to the regular refrigerator in Nevis for safe administration without their needing, the requirement of a negative 20 degrees fridge there. Thanks.
Thank you very much to all who came and answered the questions, and thank you to all of you who continue to pose your questions in the interest, because all of that is part of the management of the pandemic here in St. Kitts and Nevis. I read recently from a vaccine expert that we are only at the beginning of this pandemic. And the rationale is that only 15% of the global population has been vaccinated. And as long as that is the problem with vaccine inequity around the world, then the pandemic is going to be with us for a very long time, because we are all connected globally. The world is a global village. And so therefore it requires that all countries receive vaccines and have a significant portion of their populations vaccinated. Otherwise, the threat of COVID-19 will continue to loom and new variants will emerge, and that is going to be a whole problem again. Thank you very much for joining us today for our press briefing. I want to thank Dr. Cameron Wilkinson, our medical chief of staff at JNF General Hospital, our chief medical officer, Dr. Hazel Laws, our Minister of Health, Honorable Keela Byron Nisbet. We want to thank Mr. Abdias Samuel, the chair of the National COVID-19 Task Force. We also thank the Honorable Wendy Phipps. We thank Mrs. Christmas Jacobs for her service, and we thank ZIZ, and we continue to thank all media houses in the Federation for playing their part in terms of the information and the management of the COVID-19 pandemic. And we thank all of you for playing your part with the management of the COVID-19 pandemic. We will be back next week with another press briefing. Until then, take good care. I am Les Roy Williams.